Hey everybody. So our third attempt at Facebook Live here. We're going to see if this actually works. Our video kind of screwed up last time, but hopefully you got the content. Anyways,
yeah. Today we're coming from our phone. We're trying the phone version.
Yeah.
Last time, or the first time we did Facebook Live, we had the phone twisted sideways. So if you see Kevin and I close together, it's because we're trying to fit, our big heads.
Trying to hug it out.
Trying to fit our big heads into this tiny little screen.
So today actually, well, if we recap from last time, we had a good talk about stress and the adrenal glands, and forgot to mention too that, along with these talks that we're going to do every Friday, we're going to also have more detailed kind of seminars that we're going to do in-house. And November 21st, I believe it'll be, all the rest of the info will be on the website. We're going to have a more detailed talk about the adrenal glands, stress, the effects, what are some simple solutions that we can go into a little more detail with patients.
Exactly. So these Facebook Lives are just kind of introductions to it. They are more detailed. There's a lot more information on it, and that's what we want to provide at our in-house talks. So the first one will be, we said November 7th?
21st.
Yeah. November 21st, we are doing stress and the adrenals, and that's a really important one. With our Western lifestyles, and so we're going to dive into it a lot deeper, figure out some more solutions for you guys, and simple things that you can implement into your life. But today we're talking about inflammation. So this is another huge topic. So we're going to be with you for about 15-20 minutes today. If you have any questions, don't hesitate. You can write them down below. If our screen goes green, please let us know, because that's what happened last time, but we had no idea. Because we're looking at ourselves right now and we look pretty good, but our feed looks like it's okay. So inflammation.
So I guess, like me, Sean, you must talk to patients all the time about this, because a lot of people have it, and there are many reasons why, but maybe what we could explain is like what we were discussing before about, most disease or dysfunction in the body. At the root of that, there's usually an inflammatory beginning, right?
Reaction.
That started, and that's created a problem in the person's body.
Whatever the tissue system, it starts with inflammation, right? So it starts with something aggressing or attacking, and then the inflammatory response. So
maybe we'll go through simply at first, like, well, what would you complain of, like, if you did have an issue with inflammation in the body? It could be many things, right? Like, most of what I hear in our common stuff that we hear in practice is we have like people with achy joints. You wake up in the morning, you're super stiff and achy, and it takes a time for you to get going. There's a lot of like digestive involvement, things like brain fog, things like that. I don't know if you can think of anything else.
There's so many, right? So many symptoms and disease processes start from inflammation. So any of the itises, so like we talked about, epicondylitis, tendinitis, all these itises, that's all inflammation, right? That's inflammation at the attachment of something. Bursitis, but then it goes into like allergies, cramps, muscle cramps, vision, acne, eczema, dermatitis, like the list goes on and on. Cardiovascular inflammation, right? So at the root of all disease is inflammation, and it gets into, and it progresses from there into like rheumatoid arthritis, multiple sclerosis. These are like down the line of an inflammatory reaction that has allowed to progress for a long enough time that then leads to these conditions that we're seeing every day. Right? We're seeing these every day.
There's one cool thing with the when we do have someone come in with inflammatory issues, you often see too they're complaining all of these same symptoms like achiness and everything else too, that they're really weak and they don't feel like they have the energy to do things. So we'll show them too that normally muscle testing and things like that, you would see like they have many muscles in the body that are weak. And one interesting fact that we can talk about now is anything to do with an anti-inflammatory, like an Advil, let's say, would actually make the person feel better. If this is the case, that you do feel better from taking an Advil, it's a very good indication that there's inflammation in the body. So and even to the point when we actually test and apply kinesiology with that, you'd have the person have an Advil under their tongue, and all those muscles that were weak would actually turn back on.
So before we get into like all the conventional treatments and what we would do in here to help address inflammation, inflammation is caused by an imbalance in something called prostaglandins. So we have there's three main ones and maybe a fourth one that they're discovering, but prostaglandins they're everywhere in the body, they're in the cell, and what these can either be anti-inflammatory or pro-inflammatory. And what happens in our Western world, and the stresses of everyday life and the foods that we eat, we create an imbalance in these prostaglandins. So the ones to remember are, there's, let's say, prostaglandin 1, prostaglandin 2, prostaglandin 3. Okay, so those three, 1 and 3 are actually anti-inflammatory, and 2 is pro-inflammatory.
Yeah.
Okay, so that's just at the root. Now, what we have something called essential fatty acids, right? So essential fatty acids are actually precursors to these prostaglandins, okay? So we actually need these prostaglandins. We need them, but we need a correct balance of them. What we're seeing when we're in an inflammatory state is we have a lot of PG2, which is the pro-inflammatory, that's kind of wreaking havoc on the cell and the rest of the depending on the tissue system that's involved. So
basically so they understand, like the balance factor between all these prostaglandins is off. Exactly. And if you have more of one that's pro-inflammatory, you would be subject to having a lot of inflammation.
Yeah, exactly. And then from inflammation, right, it's kind of like the stress complex we talked about. It's like a rob Peter to pay Paul. So your body's trying to put out the fire, but those PG2s are out of balance. And so what in the traditional, I guess, medical model, we address these prostaglandins with things like, non-steroidal anti-inflammatories, right? Acetaminophen, aspirin, COX-2 inhibitors. So what these do is a COX-2 inhibitor is actually, just imagine an enzyme that like something gets converted to something. So what these try and do is they try and block, right? They inhibit the ability for it to
make the bad one.
Make the PG2. Yeah. But what also happens is that they also block the ability to make the PG1 and the PG3, which are so important for our cells, our life, right? Yeah. For function in the body and anti-inflammation, right? So there is a bit of a...
This is why, too, that some of these can be very helpful, let's say in a situation where it's crucial,
Yeah, it's crucial.
You need to get rid of inflammation fast.
Exactly.
These shouldn't be something you're taking on a long-term basis.
And that's where we see the problem. Yeah. It's like, again, like
long-term use,
Exactly. Like Kevin said, if you're in an injury or you're playing a sport and you twist your ankle and you get this crazy inflammatory reaction, well, for the first 3 days, it's actually okay to put a topical would be better, but a topical NSAID, right? So a topical non-steroidal anti-inflammatory, because you want it to act on that area. Like if I sprain my wrist, I want it to act on that area. I don't want it to have to go through my stomach and affect the lining of my stomach, which we'll get into, which then long-term use creates even more inflammation, right?
So good point about the stomach, because that's one of the other reasons why people get inflammation.
So typically you have a sore joint, and what do people say? We've been led to believe that, unfortunately, health comes in a bottle, right? It doesn't. Okay, health comes from within, and we need to learn how to restore health properly. But the way we've set up our world right now is you get a headache, you take an Advil, right? Yeah. You have an achy joint, you take an Advil, right? So instead of looking at all the factors that go into that, you pop the Advil, and it feels better. Well, guess what? Next day, you're like, oh, my wrist still hurts. Well, what do? You take another Advil. And we see this every day. People will say, oh, yeah, I take an Advil in the morning, I take an Advil in the afternoon, I take an Advil in the evening. Okay, that's actually very scary, right? So now, three possibilities. Let's say so the three possibilities about if you do respond to an Advil, right? Yeah. Here, I'll let Kev. Sorry, I'm talking a lot. Go for it.
Yeah. So if you respond to an Advil, then we it gives us a good indication that there is a good amount of inflammation in the body that is causing havoc. So then the key part is figuring out, well, what's causing that inflammation. So there could be many things, like Sean talked about, an imbalance in essential fatty acids, which, let's say someone that wouldn't eat fish or have anything in their diet where they have good fats and oils, to replenish that need, then we would advise them on some sort of recommendation on either an omega or something like that can help them rebalance those factors. So that's one way. One other cause, a major cause that we see often is obviously intolerances in someone's diet. So the body's designed to kind of attack things that don't make it feel good. So the resultant factor is inflammation in the gut. Now, if this is repeated and there's chronic abuse of that, then you can see cases where the gut becomes what they call leaky gut, which would be, it becomes permeable. So like there are holes in it.
Yeah, and it lets in things that it shouldn't, creating more inflammation systemically. Okay.
So then now you have that going around your blood system, going everywhere in the body, including the brain. So these are things that we want to avoid. So then that process would be to see. A lot of people know what they're intolerant to because they'll often come in and they tell us, it's often what they eat the most of.
Yeah. So and it's also, we say this all the time. Listen to your body. So if you eat something, you get gas, you get reflux, you get dry mouth, you get itchy skin. Like your body's giving you signals all the time. Check engine lights. So you gotta connect to it and listen to them.
Well, good point with the check engine light. So like we said last time, the key part about all this process too is being a little bit more aware of a reaction or a feeling that you're getting from something. I think people are very capable of doing this. Like they're often not aware of it, maybe because they think it's normal, but getting gassy, being bloated all the time.
Tired.
These are not normal symptoms for
when you eat food
someone
that nourishes your body, right? When you eat anti-inflammatory foods.
So, at the clinic, when what we do for that factor, when it comes down to something digestive, there are processes that we can do to test intolerances and things like that.
To zero in on what potentially may be causing this inflammation.
To allow the system basically to come back and your immune system to rebuild itself properly. Yeah. That way we can repair that type of problem. That's probably the two biggest ones that we see on a more regular basis. Obviously, the same idea as what we talked about last time: stress, emotional stress, different types of stressors, physical stresses can also have an impact on creating inflammation in the body. So we always go through a checklist of things with a patient to make sure we really get down to the root cause of why that's occurring. Because if we can get that, then at least we know we can move forward and allow the body to recoup and start fighting its own battle properly again and more efficiently. Because that's the key part about the preventative medicine is just you often don't see the kind of result in the immediately in the beginning. It does happen sometimes, but the key part is remembering that you're always working on a system in order to make the whole body a lot more efficient. So if you can get it to a point where the machine is working way better, well, then now we're in a more efficient pace. The body can handle a lot more stuff. But if you don't realize that it's breaking down because you're either eating something that's aggravating your system so much to the point where it's causing all this inflammation, well, you're not gonna notice it till things probably get pretty bad. So like you got to really pay attention to signs like that. Yeah. And obviously, again, if anyone ever had questions, you can always ask us too. Just to see in your particular case, well, what could it be? These are often things we can answer.
So let's kind of recap because inflammation is a broad subject. So inflammation is at the root cause of all disease and disease processes. Inflammation is caused from a number of things. It's stress to the body in one form or another that creates an imbalance in your at the cellular level of prostaglandins. Okay, we have good prostaglandins, we have bad prostaglandins. Conventional treatments right now, what they do is they provide kind of like a grenade effect on all these prostaglandins, which is not good, right? So if we're taking an Advil, we're going to block the anti-inflammatory prostaglandins as well. Okay. One of the easiest ways to start to rebuild and to rid yourself of inflammation is through the gut, right? Because long-term use of these non-steroidal anti-inflammatories is actually what Kev said, not just food intolerances that create leaky gut, these NSAIDs. So if you use Advil all the time, you're creating a leaky gut.
Or stomach ulcer.
Or stomach ulcers, right? There's so many side effects to these things that we're not really told about, and if taken a long time, actually begin to happen, which then is just it's a catch-22. Now it's a vicious cycle because you take these to help you rid of pain, right? And then you're getting leaky gut, which is actually creating more systemic inflammation. So then you can get into the other situation where you've been taking these for a long time, but now you don't respond to them as well, right? That's a whole other, right? Because we talked about inflammation and joint pain. So if you're taking these, Advil, whatever, acetaminophen, aspirin for a long time, guess what? Now it starts to actually attack your joints, right?
Yeah.
So it's crazy that in an acute reaction, it's okay, and especially okay to apply something topical. But to take these for a long time, we really need to address the true cause of inflammation, which is through the gut. So eliminating different intolerances, supporting different systems with the essential fatty acids that we talked about. So fish oils.
Added to your intolerance thing, not just the intolerances, potentially inflammatory foods altogether. So it's not necessarily maybe someone could have an inflammatory food and not really have a massive reaction, but if they had it all the time,
so that's actually perfect. So we talked about those different prostaglandins. So PG1, PG2, PG3. Well, PG2, which is the one we want to try and avoid, right? And that, like I say, it's just a chain reaction, a chain of events. So what is a precursor to these PG2 is actually corn-fed red meat, right? Dairy, some different shellfish and mollusks, but I think that's it. So those red meats, right? Certain grains, right? Certain sugars. So when you eat those are actually pro-inflammatory. They promote that chain down to this PG2, which is inflammation, right?
Sugar, obviously.
Yeah, sugar.
Yeah, huge.
So just removing those from your diet, so getting rid of the badly raised red meat and the dairy is huge on reducing inflammation in the body.
We could probably, hopefully there's no dairy farmers out there. We could probably do a whole seminar just on dairy.
Exactly.
So there's some very, very interesting research on the effects of that casein and what it does to the gut, creating this leaky gut syndrome. And even my wife was reading an amazing book on the effects of that on autism.
Oh, yeah.
So anyway, so not to get into that, but the whole digestive tract is essential for brain functioning.
Yeah.
So Sean was saying, dairy, we had the
badly raised red meat.
Sugar,
right? So even if you just took those from your diet, you would start to have less inflammation. You'd have less reaction in the body. Your joints might just start to feel better. All sorts of things start to work better when you have less inflammation. Okay, it takes a bit of time though. So the number one goal, like we said, with ridding inflammation is trying to treat the root cause. So removing those things that are creating the inflammation, supporting the systems the systems that help with the anti-inflammatory components of that prostaglandin balance. So better diet, omega-3s, right? Fish oils, different exercise, right? Exercise actually helps the body rid of inflammation. Respiration, right? Breathing. We talk about this all the time. Breathing helps the body oxygenate the cells, right? But I think that in a nutshell, that kind of covers what we can.
Well, that's it. And I think obviously this one would warrant doing an extended seminar, which we'll definitely have. We'll go into more detail about why some of these elements we mentioned, like dairy and stuff like that, can have that inflammatory effect on the body, just so that we can show people a lot of the research behind it.
But just before going, I'll read you the things that happen to the body when you have a continued use of Advil, right? Because everyone pops Advils all the time. So these are these non-steroidal anti-inflammatories. So there's a few of them that are grouped into that title. But this is crazy. So you have gastrointestinal bleeding. Okay. Ulcers, damage to the kidneys and liver, vision problems. You have
bone's a big one.
Bone degeneration, and this one's crazy. Is the leaky gut, right?
Yeah.
So those are just a few things that happen. So our main message here is listen to your body, try and rid your diet just easily. Well, I guess it's not easy, but it's a low-hanging fruit on the list of how do we get ourselves less inflamed.
Well, I think it'll be easy too once we do have a more detailed discussion about why. Like, what are the effects? When people understand it, it's a little easier to avoid it.
Yeah.
When you don't really know and you've always been used to doing it, and I get it. Like, I probably haven't drank milk in like 12 years, and why? Like, we did a lot of reading and on why it does. And
you don't know until you know, right? So
that's it.
So low-hanging fruit, try and rid your diet of inflammatory foods.
Yeah.
Try and add in, right, anti-inflammatory foods. So I think it's funny because if you eat good foods, they're not inflammatory in the first place. So so you don't even have to call them anti-inflammatory foods.
A lot of dark greens. Obviously.
It's not rocket science, but avoid like we say sugar, the badly raised red meat, the dairy. Even if you just started with those, increase water.
Some of them are the same as like the stress one we just did. Like exercise, breathing, making sure you're getting adequate amounts of water, hopefully filtered water, and that's it.
So we're going to be back next week. We're going to do another Facebook Live. Steph will send out a note early on in the week, and then keep in mind November 21st we're going to do a in-house live event on stress, adrenals, adrenal health, tips, techniques, everything that you can do to help deal with stress, right? Stress, just like inflammation. The stress response, the inflammatory response is needed by the body. It's when it becomes chronic that we get into trouble. So, have a great weekend. Hopefully this video worked and we weren't green or sideways. Exactly. And we'll get closer together next time so you can see all of our heads and not just half of our heads. But we'll figure this stuff out.
All right, thanks guys.
Thanks.
Talk soon.
Have a good one.